Hi everyone, I am Dr. Anisha and I welcome you to my channel. In today's discussion, we shall be dealing with one of the most important topics of dental histology, that is your enamel. You have already seen it in the thumbnail. So, a lot of short notes and long notes are being asked from this chapter, from this topic. So, we shall be dealing all of them one by one. But before starting the discussion, I would like you to kindly subscribe to my channel for further videos. In this topic, we shall be dealing with different, short notes which are being asked in the examination, different long notes which can be asked. So, in this video, I shall be dealing with the physical and chemical properties of enamel. Then we shall be talking about striae of Retzius. And the next topic which shall be covered in this video will be your Hunter-Schreger band. So, these are the topics which I am going to discuss in this video. So, let us proceed. Now, when I talk about enamel, so firstly we shall be discussing the physical characteristics which we are supposed to understand. आप कुछ ऐसे फैक्ट्स हैं एनामल के बारे में जो हमें ज़रूरत है जानने की. एंड फर्स्टली वी शैल बी डीलिंग विद द फिजिकल कैरेक्टरिस्टिक. सो एनामल फॉर्म्स अ प्रोटेक्टिव कवरिंग विच इज़ ऑफ वेरिएबल थिकनेस ऑन द क्राउन एज वी ऑल नो. The cusp of molars and premolars have maximum thickness which is of 2 to 2.5 mm in thickness. All right. Now the functional cusps are thicker in size, and your lingual cusps which are functional in your upper molars, and your buccal or palatal cusp which are functional in your lower molars are the functional cusps. All right. Now the hardest calcified tissue is your enamel in the human body, and due to its high content of mineral salts, it is hardest substance of the human body. All right. Now this specific gravity of enamel is 2.8, kindly remember this. The density decreases from the surface to deeper layer and from cuspal to incisal region. We shall be knowing all about them in the further discussion. Now if I talk about the permeability of enamel, it has been found with radioactive traces that enamel can act as a semi-permeable membrane. Alright, please keep this in mind. Now the color of enamel, it ranges from yellowish white to greyish white, depends upon the translucency. See, as I already told you, the enamel, the constituent of enamel are somewhat semi-permeable, also they are translucent, and because of that the color of the enamel varies, varies from yellowish white to greyish white. Now yellowish teeth are thin, alright, they are thin translucent enamel, they have thin translucent enamel, and that is why the dentine which is present beneath the enamel, it appears yellowish in color, alright. And whereas the enamel which is more opaque, in that case the teeth is going to be greyish white in color. In incisal area, it may have a bluish tinge where the thin edge consists of the double layer of enamel. So this is all about the physical properties of enamel. These are some of the facts which can be asked as a viva question. So kindly keep this in mind. Moving on to the chemical properties of enamel, let us see what is the composition of enamel which is present in the tooth. So basically the chemical composition of enamel, it consists of two parts. Firstly, we have an inorganic material which constitutes 96% of the total enamel, and secondly we have organic substance plus water which constitute 4% of the same, right. So talking about the organic substance which consists of unique proteins. So basically we have two kinds of proteins which are present. Firstly we have amelogenins and then we have non-amelogenins, alright. So again please keep this in mind, the amelogenins which are present, they have low molecular weight proteins. They are basically low molecular weight proteins and they constitute 90% of the enamel proteins. So it can be a viva question. So 90% of enamel protein is formed by amelogenins, and amelogenins are hydrophobic and are rich in proline, histidine, glutamine and leucine. So this is something which is to be remembered. Now if I talk about non-amelogenins, which constitute the other 10% of enamel protein, they are basically enamelins, they are ameloblastin, and thirdly tuftilin. So these three kinds of non-amelogenins are basically present in the enamel, and they form the organic substance of the enamel. So non-amelogenins are high molecular weight proteins, and they are rich in glycine, aspartic acid and serine. So all of these constitute the organic portion of the enamel. Now moving on to the inorganic material of enamel, which is hydroxyapatite. Kindly keep this in mind, जो आपका inorganic material है enamel का, that is formed by the hydroxyapatite. The formula is C10PO4,6OH4,2. So this is the chemical formula, C10PO4,6OH4 twice. Alright, so hydroxyapatite crystals are hexagonal in cross section. The shape of single crystal under high resolution can be a rod with an equilateral hexagon base. Alright, the crystals are arranged to form enamel rods or enamel prisms. So kindly keep this in mind. We have hydroxyapatite crystals, and these crystals are arranged to form enamel rods or enamel prism. So hydroxyapatite crystals has a central core of hydroxyl ion around which calcium and phosphate ions are arranged in the form of triangles. Kindly refer to the diagram. So we have one central hydroxyl ion, and your calcium and phosphate ions are arranged in a triangle manner, okay, around them. Now pores are present in the crystals, especially at the boundaries of the rods, and these are filled with water. Alright, so water is present as a part of crystal, between the crystal and between the rods and the surrounding the rods. Enamel matrix mineralization begins immediately after it is secreted. Alright, so there will be secretion of the enamel matrix, and just after that mineralization is going to take place. So this was a brief description about the overall structure of enamel, what all ions are involved in this, and what is the chemical formula of hydroxyapatite. This can be a viva question also, so please keep this in mind. Let us talk about the structure of rods, structure of enamel in detail. So we have enamel, and the enamel is composed of enamel rods or prism or rod sheath, and in some regions cementing interprismatic substance. So let us talk about the structure of enamel in detail. जो आपका enamel है वो basically rods से form होता है. So the enamel is composed of enamel rods or prism, and it has a rod sheath, and in some region cementing interprismatic substances are also present, right? The number of enamel rods are 5 million in lower lateral incisor to 12 million in upper first molar. So the thicker the enamel, the more rods will be present, it is but obvious. Now the direction of arrangement is oblique and wavy course of the rods. Alright, you can see in the diagram, diameter of rods increases from the dentino-enamel junction towards the surface of the enamel at the ratio of about 1:2. Alright, so the maximum diameter of the enamel rods will be at the surface of the enamel, okay, and the clear crystalline appearance is seen, which leads to permitting of light to pass through them, okay. So basically enamel rods have a clear crystalline appearance, and it leads to permitting the light to pass through them, okay. Under light microscope, what do we see is they occasionally appear hexagonal, alright. Sometimes they appear round or oval also. The cross section of human enamel, it may appear as a fish scale. It can be a viva question, so kindly remember this. As far as outline of enamel rod is concerned, it has an arcade outline at the DEJ and a keyhole shaped outline at the enamel surface. So this is also a very potential viva question. I am pointing out all the viva questions which can be asked, so kindly prepare them accordingly. Now, this is all about the basic structure of enamel, alright. So, we had enamel rods, rod sheath is present, and also interprismatic substances are present. I told you how does it look at different microscopic level, what are the appearances, how is the outline, the thickness of enamel rod, the numbers of enamel rods. Okay, so this is all basic which we need to understand while studying about enamel, so kindly keep everything in mind. So this was all about the physical appearance and the chemical composition of enamel. Also we talked about the structure of enamel in a very detailed manner. Let us move on to striations. What are striations? So this is a very potential short note which can be asked in your examination. So when I talk about striation, kindly refer to the diagram. Each enamel rod is built up of segments separated by the dark lines, alright, and it gives a striated appearance. So more pronounced in enamel that is insufficiently calcified, the striations are very much prominent or pronounced in those enamel which are insufficiently calcified. In humans, the segments are of uniform length and are of about 4 microns. The cross striations seen in light microscope is due to the diurnal rhythm in the enamel formation. So again I shall repeat, each enamel rod is built up of segments separated by dark lines, alright. So enamel rods have dark lines which are separating the two enamel rods, and it gives a striated kind of appearance, okay, whenever you see in the microscope, and these striations are more prominent in those enamel which are insufficiently calcified, alright. So this is all about the striated appearance of enamel. Now moving on to the most important, one of the most important topics which can be asked as a viva question and also short note is your Hunter-Schreger bands. Whenever we talk about enamel, एक topic जो कि बहुत important है and you need to know this topic very well is your Hunter-Schreger bands, alright. What happens is, whenever there is change in direction of rods, it may be regarded as a functional adaptation, minimizing the risk of splitting in the axial direction under the influence of occlusal masticatory forces. So what happens is, whenever there is a high masticatory force, what happens is there is a functional adaptation in the direction of rods which takes place so as to prevent the splitting of the enamel rods in the axial direction. जब भी कोई masticatory force, कोई high masticatory force अगर आपके enamel पे पड़ रहा है, तो जो enamel rods हैं वो functional adaptation की वजह से अपना जो डायरेक्शन है वो चेंज कर देते हैं ताकि जो एनामल रॉड्स हैं वो एक्सियल डायरेक्शन में स्प्लिट ना कर जाएं. सो बेसिकली व्हाट हैपेंस इज दिस चेंज इन डायरेक्शन ऑफ रॉड्स इज रिस्पॉन्सिबल फॉर द अपीयरेंस ऑफ हंटर-श्रेगर बैंड्स. सो जब भी हम हंटर-श्रेगर बैंड्स की बात करेंगे तो जो आपका मोस्ट एक्सेप्टेड रीजन है हंटर-श्रेगर बैंड का, दैट इज योर चेंज इन डायरेक्शन ऑफ रॉड्स, ऑलराइट. These are alternating dark and light bands of varying width that can be best seen in the longitudinal ground section under oblique reflected light. So keep this in mind. This is the most important part. What are actually Hunter-Schreger bands? Band है, नाम से समझ में आ रहा है. जो इसका appearance होगा वो एक band की तरह होगा. So basically they are alternating light and dark bands of varying width, alright, that can be best seen in the longitudinal ground section of enamel under oblique reflected light. So you have to get a longitudinal ground section of the enamel to see the Hunter-Schreger bands, and also this should be seen under oblique reflected light. Alright, they originate at dentoenamel border, kindly refer to the diagram, and they pass outward ending at some distance from the outer enamel surface. So basically what happens is they originate at the dento-enamel junction and they pass outward, ending at some distance from the outer enamel surface. Prisms which are cut longitudinally to produce dark bands are called diazones. So those enamel rods or prisms which are cut longitudinally, they produce dark bands because they do not allow light to pass through them, alright, and they are known as diazones. So those portion of bands which appear darker to you are known as diazones. Please keep this in mind because this is something which confuses us very frequently. So we have two zones. First is your diazone and next is your parazones. So it is very simple to learn, बहुत easy है याद करने के लिए. D for diazone, D for dark band. So वो सारे bands जो आपको dark नज़र आ रहे हैं because जो यहाँ पे जो enamel rods या prism है उनको longitudinally cut किया गया है, okay. So they produce dark bands and they are known as diazones, alright, while the prism which are cut transversely to produce light bands are known as parazones. The angle between diazone and parazone is about 40 degree. Kindly keep this in mind, you have to mention this in the notes. Also, enamel crystals aggregate in each zone of Hunter-Schreger bands deviated not only in opposite direction but also tilted to about 50 degree to the central axis, alright. These structures may not be the result of an optical phenomenon only, but they are composed of alternate zones having a slightly different permeability and a different content of organic material. Now studies have also shown that ये सिर्फ एक ऑप्टिकल फिनोमिनन नहीं है, इन दोनों बैंड्स का जो आपका ऑर्गेनिक मटेरियल का कंटेंट है दैट इज ऑल्सो डिफरेंट एंड ऑल्सो दे हैव डिफरेंट जोन्स ऑफ permeability also. But then the opinion that Hunter-Schreger bands are a result of change in direction of rod is largely prevalent and widely accepted. So basically if you are being asked about the reason of Hunter-Schreger bands, so firstly you have to mention कि ये जो basically ये जो bands हैं ये they are produced because of change in the direction of enamel rods, and also studies have shown that, you have to mention this, studies have also shown that this is not only the result of only the optical phenomenon but also both the bands have different level of permeability, also they have different content of organic material, but this aspect is not widely accepted, and the optical phenomenon wala jo reason hai because of change in direction of enamel rods is widely accepted and is very prevalent. So we tell this reason only because reason for the presence of Hunter-Schreger bands. So this is all about Hunter-Schreger bands. I hope I made it clear to you. This is one of the very frequently asked questions in the examination, so kindly prepare this very well. Moving on to the last topic of today's discussion, that is your incremental line of Retzius. Again, one of the most important short notes which can be asked in the examination. So we are talking about incremental line of Retzius. They appear as a brownish band in the ground section of enamel. So whenever you take an enamel ground section, so you will see some brownish bands kind of a thing. Kindly refer to the diagram. They illustrate incremental pattern, okay. So as we all know, enamel is secreted by ameloblasts, and this secretion is an incremental kind of secretion. एक continuous secretion नहीं होता है, ये increments में enamel जो है वो lay down होता है, and इस increment को हम कहते हैं enamel में incremental line of Retzius. So ये एक viva question भी है, and also it can be asked as a short note. So they illustrate the incremental pattern of enamel, that is successive apposition of layers of enamel during formation of crown. In longitudinal section, they surround the tip of the dentine, alright. In cervical part of the crown, they run obliquely. From DEJ to the surface they deviate occlusally in transverse section of the tooth. अगर आप एक transverse section लेंगे tooth का तो जो incremental line of Retzius है they appear as concentric circle. Obviously incremental lines reflect variation in the structure and mineralization, either hypomineralization or hypermineralization that occurs during the growth of the enamel. So what happens is ये जो आपके incremental line है इनसे आप बहुत कुछ conclude कर सकते हैं. Incremental lines जो है they reflect variation in the structure and mineralization. Either the enamel is hypomineralized or the enamel is hypermineralized. Okay, that occurs during the growth of the enamel. The incremental lines have been attributed to periodic bending of the enamel rods, to variation in the basic organic structure, or to a physiologic calcification rhythm. Alright, the mean daily rate of enamel formation of about 3.5 micron increases from the inner to the outer enamel, and it decreases from the incisal or cuspal region to the cervical enamel. Okay, the incremental lines of Retzius, if present in moderate intensity, are considered normal. However, the rhythmic alteration of periods of enamel matrix formation and of rest can be upset by metabolic disturbances, causing the rest period to be unduly prolonged and the lines closer together. Alright, so what happens is जो आपके incremental line of Retzius हैं अगर वो moderately present हैं, so they can be considered as a normal variation. Alright, but अगर rhythmic alteration of periods of enamel matrix formation and of rest अगर upset हुआ है, अगर disturb हुआ है because of some metabolic disturbances, तो जो रेस्ट पीरियड्स हैं दे आर अनड्यूली प्रोलॉन्ग्ड एंड ये जो लाइंस हैं ये काफ़ी आपको क्लोज नज़र आएंगे. सच एन एबनॉर्मल कंडीशन इज रिस्पॉन्सिबल फॉर द ब्रॉडनिंग ऑफ incremental lines of Retzius, rendering them more prominent. All right, so again I'll repeat, ये जो आपके incremental line of Retzius हैं they are basically the lines which are formed by the apposition of the enamel, and ये basically either ये hypomineralization of enamel को reflect करते हैं या hypermineralization of enamel. Depending upon them the lines can vary. All right, again अगर ये moderately present हैं तो they have been considered normal, but if there is some disturbance, metabolic disturbance, so what happens is there is rhythmic alteration of the periods of enamel matrix formation and of rest period, so this rhythm is upset. All right, and because of that the lines are closer together, and this is why there is alteration in the width of the incremental line of Retzius. Such an abnormal condition is responsible for the broadening of incremental line of Retzius, rendering them more prominent. All right, so kindly refer to the diagram also, and one thing I want to make very clear, that whatever question is being asked, kindly correlate each and everything with a diagram, explain everything with a diagram in your examination. That is going to fetch you more marks. Also you will be clear with the concept. The examiner will know that you are clear with the concept, so diagrams are always necessary whenever you are appearing for the dental histology exam. So kindly refer to the diagram. I hope I have made all these topics clearer to you. Also, if you have any doubts, kindly get back to me in the comment section. In the next video we shall be dealing with different structures of enamel. I shall be talking about enamel lamella, enamel tuft, pericymata, enamel spindle, Nasmyth's membrane. All right, what are neonatal lines. All these topics which I am telling you are very potential examination question, which which are asked as a short note. So we shall be dealing all of them in a very detailed manner with diagram. So stay tuned and kindly subscribe to my channel for further videos. So if you have any doubts, kindly get back to me in the comment section. If you liked my video, kindly subscribe to my channel for further videos. Thank you so much.